Bismillahirrahmanirrahim. So in this lecture we are going to study about the class 1C sodium channel blockers. In the lecture before we have already discussed the class 1B, class 1C sodium channel blockers, the mechanism causing the cardiac arrhythmia and the normal cardiac action potential. We have already discussed such kind of topics in the lecture before. So in order to understand these drugs, you must watch the lectures. So talking about the class 1C sodium channel blockers, so the important properties, general features are that it has a maximum sodium channel blockers activity, and this will cause the marked depression in the phase 0 depolarization, and thus it will cause the marked depression in the conduction velocity, as we have already discussed that conduction velocity is due to phase 0 depolarization, and this mostly occurs in the tissue like Purkinje fibers, bundle of His, and the accessory pathways, and these are the main pathways for the generation of erythria due to impulse conduction. So blocking these pathways, इन pathways में conduction velocity को decrease करने से क्या होगा कि arrhythmia generation due to impulse conduction वो क्या होगी, due to defects in the impulse conduction वो क्या होगी, वो decrease हो जाएगी. तो ये इस लिहाज से important नहीं. In this sodium channel blocker activity is so marked that it can decrease the conduction velocity even at the muscles which are at rest. So this can lead to its pro-arrhythmic activity. The second important point is that it has no or very little effect on the effective refractory period. It has no or very little effect on the effective refractory period. So the first drugs which is class 1C sodium channel blockers, which is called the Flecainide or the Flecainide, etc. Flecainide or Flecainide. Flecainide is another drug but belong to this drugs group. Important point that it has the beta blocking activity, and this will cause the negative inotropic effect on the heart, and thus it is contraindicated in the congestive heart failure. It has a much more beta blocking activity. It is mostly used in the condition like atrial flutter fibrillation, in the bypass tract mediated tachyarrhythmia, and the ventricular tachyarrhythmia. It has an adverse effect like blurred vision, although it is better tolerated. Like it can cause the blurred vision, GI side effects like nausea, vomiting, and diarrhea. And the important point is that it is pro-arrhythmic in this patient which have already a heart disease. It is pro-arrhythmic in the patient which is already have a heart disease, and it has proven through the research which is called CAST, and it stands for the cardiac arrhythmia suppression test. इस रिसर्च में क्या किया था कि जो पेशेंट थे जिनमें माइकार्डियल इंफार्क्शन रिलेटेड वेंट्रिकुलर एरिथमिया था, उनको प्लेकेनाइड दिया ताकि उसकी जो वेंट्रिकुलर एरिथमिया है इसको ब्लॉक कर सके. लेकिन हुआ ये कि इसने क्या किया, increase the mortality. So it is contraindicated and much very pro-arrhythmic in the patient with the underlying heart disease. So it is not used. Due to this, it is not used now. The second drug is the Profapenone. It has the same properties except that it has a very mild beta blocking activity, and it causes the adverse effect like dizziness, lightheadedness, and the ataxia. It is also called metallic taste in the mouth, and the important adverse effect that it is called lupus-like facial rash, which is exanthematous pustulosis. It is also pro-arrhythmic as the Flecainide, and its uses are the same as we have discussed in the Flecainide.